Hey, how you doing?
Good, good. Can you hear me okay?
I can hear you. Can you hear me?
Yeah, I can hear you perfectly. So, a little bit
Fantastic.
choppy. I'm
Thanks
not
for
sure
having me
why,
on.
but yeah, so
Yeah, we,
got a lot of questions. So, I'll get right at it. You've been busy. So, I know that there's a lockdown coming tomorrow. What do you think the lockdown is going to look like?
well, I mean, I think it's clear that we need to take a few more measures to really address the really high rates of transmission in our community. I think it's really important to note that you don't want to be at, 300, 400 a day for too long. Certainly, I've got colleagues in Western Europe who have been through this as well, and they say, yeah, you're cruising along 2 weeks at 400, 500 cases a day. Next thing you know, it's 1,000, 2,000 cases a day, and then it just grows. It's kind of like compound interest.
Yeah.
I imagine there's going to be some forms of measures. It's probably going to look pretty similar to some of the previous closures that have already been taken. So, and certainly knowing that a lot of people have made a lot of sacrifices. I mean, I'm sure things they're looking at are indoor dining, gyms. Again, those have been a constant one. I imagine they're looking at places of worship because that was an area that I had spoken about in my letter of instruction. Additional advice on social gatherings, all these other pieces. And so I think it's a couple of things that we need right now in Peel. We need to take some immediate short-term measures to bring the current numbers under control, and then we also need to take other measures to actually address some of the other drivers of transmission in our community. So paid sick leave for people that are precariously employed, the isolation center, which is coming online to help people that are living in crowded housing, and then certainly just everybody in the community doing their part to try to stay home as much as possible, close contact only with the people you live with, and then limiting essential contact outside the house to just the most essential reasons with precautions.
Do you think non-essential retail will be closed down tomorrow?
I don't imagine anything's off the table, and certainly the premier has been very clear that his goal is to really take steps that are going to protect the health and safety of our residents. I got to tell you, I'm all for an approach that balances the harms of potential closures with the harms of COVID. But I think everyone remembers that if your cases start getting out of control, if you're starting to see hospitalizations, which is a big issue that we're seeing here in our community, hospitalizations, a lot of people in ICU, that means that the scales are tipping over to you got to control COVID. So non-essential retail, sure, I imagine that might be on the table being discussed right now, along with all the other things that we've discussed previously.
Last time Mississauga went to the red zone, you put on more restrictions on top of what the province recommended. If the province doesn't go out far enough tomorrow, will you put on more restrictions?
Well, I mean, whether it's me or whether it's together with our political leadership, I think we recognize the importance of trying to, bring this under control in the immediate term. And so certainly if we'll study the provincial announcement very carefully. And if we feel that there are additional measures that we need to take in order to protect the health and well-being of our community, then I will certainly work with our local leadership to make sure that gets done.
Okay. Were you involved in the consulting process with Doug Ford for the announcement tomorrow?
So I did have an opportunity to send in certain requests, which were aligned with the previous letters that I've made public, as certainly additional workplace pieces. I think in the media, I've been talking a lot about paid sick leave, rent support, support for impacted businesses so that they can close and do the right thing. And so those are some elements that I've touched on in my conversations with Premier Williams, with Premier Ford and Dr. David Williams. And certainly we're continuing to have conversations of the nature around different settings, et cetera, what makes sense, what doesn't make sense. But in terms of the actual decision, I don't know. It's entirely up to the province at this point in time as to whether some of the data that we've shared and the precautions that we're suggesting are adopted.
Okay. Last lockdown question. You did mention before the lockdown would not address the spread of kind of COVID-19 in Brampton because of the workplace outbreaks. So, I mean, if a lockdown won't work, what will?
Well, let me clarify. I think it's important to know I think that we need to reduce interactions overall as a whole right now, just to get cases under control. So I do support additional measures coming in the short term just to get this under control.
Okay.
But what I'm saying about Brampton, as I've said, is one of the biggest challenges we have in Brampton is that we got a ton of essential workers, also Mississauga and Caledon as well. Tons of essential workers, people that are doing jobs that you can't do from home, particularly also where if there are no precautions being taken, they're getting exposed, they're having outbreaks at the workplace. And then when they go home, they're not bringing it home to just one or two other people. They're bringing it home to, large families, sometimes multiple families that are living under the same roof. So that's why all the other pieces I mentioned in terms of worker protections, we've got some workplace outbreaks that started because workers are choosing between, you do the right thing, stay home, stop spread, but then they're worried about, making rent, putting food on the table, possibly losing their job. And we know that they can't lose their job, but that's always something that people are fearful about, right? So then they go back to the workplace and they spread it to other people, and then we have an outbreak. So it's really incumbent, even if the province doesn't move on that, like employers out there, definitely think about giving folks time off if they need to isolate or if they're sick, because the cost of having that person home for, a week or two is a lot cheaper than a whole societal shutdown. And also like a business shutdown, in my opinion.
True. This report just came out, literally a tweet came out from York Region, and I think it's a chief medical officer of the Doctors Association just there, mentioned that they don't want to be in a lockdown situation tomorrow and sent it directly to the Premier. Did you hear about this? And I'm assuming that Peel is not going to do this.
So I have heard, certainly from my counterparts in York, they're facing a very different situation. But, the reality is that the way this virus grows and the way we've been interacting, there's some people out there that are living as if the pandemic's done and as if, COVID-19 doesn't exist. And the reality is that if you live that way, COVID-19 will very quickly remind you that it's still around. That's what we're seeing. Beyond the essential worker situation that we have in Peel, in some of the other social gatherings and whatnot. And I think the experience of Halton is actually pretty instructive. They pushed pretty hard to not be put into modified stage 2. They got it for 2 weeks. And then the reality is after they looked at the numbers again, they're like, whoops, actually you folks should be in red. And so the reality is that a lot of people, they'll win these Pyrrhic victories where it's just like, okay, you're good for like another 1 or 2 weeks, but then it's going to get bad. And then the reality is you get moved forward. So I know my colleagues in York, they have a different picture right now. They're probably 1 or 2 weeks behind us in Peel. I would just urge them, urge everyone, whether they're in Peel or beyond, just really follow the precautions, because that's what we need to do to get through this at this point in time.
Sure. Vaccine questions. When are we going to see a vaccine? A lot of talk about vaccines coming out very soon.
Absolutely. There's a lot of positive news around vaccines as a whole. It's definitely light at the end of the tunnel. That should actually be something that has us redouble our efforts to get ahead of this thing, because the reality is to keep ahead of this thing, because you don't want to get COVID, like literally. The worst thing in the world would be like get COVID, before you get your shot. Like, it's not worth it, right? So I think to the extent that people can keep up what they're doing, my understanding is that it's looking good. It's hopeful for the first half of 2021 in some variety. Certainly the federal government, provincial government have made all sorts of discussions around numbers, but I'm waiting to see the official plan. I'm waiting to see the official approvals, and then hopefully we can all just keep holding on until it comes on out and changes the game.
Okay, perfect. Next 2 questions about vaccines are actually from my son. He's the one that gave it to me. So he says, if I had COVID-19 in the past, do you need to get a vaccine?
So at this point in time, we don't know a lot about how long the immunity lasts for. We also don't know a lot about what happens if you get reinfected. And we do know that you can get reinfected because we've seen some instances here and there. So the reality is, if you've been infected before, it's likely that you might not have the same priority as other people who've never been infected before, but you should probably still eventually get the vaccine at some point or another, because, you never know, immunity might go away, or, it might prevent you from having a more severe reinfection if it happens. It's a disease we're still learning a lot about. So a vaccine's a vaccine, highly recommended no matter whether you've been infected or not. That's where I'll leave it.
Okay. I have a 100-year-old Lola in a home, and I have to get, a COVID-19 test every time I see her. So my son had to get it too. Obviously, it goes up his nose. Is there a spit test coming out? That's what he wants to know.
Yeah, so there's a number of different new testing modalities that are being rolled out, being tested. I know that they're coming to high incidence places. So we're looking at a number of pilots within the region of Peel, and then hopefully those can be rolled out more widely. And it will be things like different modalities, spit tests, just throat swabs as opposed to nasal swabs. Who knows? I mean, but long story short, there's a whole bunch of different things that are being tried out here, and hopefully that'll turn the tide.
Okay, perfect. A youth sports question. What have you seen in youth sports that contributed to the spread of COVID-19?
So in general, what we've seen, and it's not just unique to us, we've seen this across the province. In terms of the sports, there's a little bit of spread that might be associated with close contact and gameplay, etc. But really what we're seeing is more the stuff before and after the game. So, it's like the sitting there socializing with your mask off within 2 meters. It's the post game, just hanging out, or worse is also carpooling. We've seen situations where people might carpool to the game together. One person's got like a bit of a sniffle, turns out to be COVID, infects like 3 other people. To the extent that you can we're trying to discourage carpooling and really discouraging sort of the fraternizing before and after the games. That'll make a difference to limiting your risk. And also, since we're in the red zone, it's all focused on practice at this point in time now, which is limiting your risk within the games, but it's the pre and post stuff that you got to look out for.
Okay. We talked so much about gyms, restaurants, theaters and things, but a report came out from CBC that said 80% of the 6.5 million total arrivals into Canada from March to November were exempt from quarantine meant to battle COVID-19 pandemic. And the biggest airport happens to be located in Mississauga mostly, and a little bit in Brampton. So, I mean, so what are your thoughts on that?
Well, so travel certainly has been a driver of transmission in our community. It goes back to the essential worker piece. We know we have a lot of folks in Peel region that drive trucks, and they do go to the United States, and we've seen truck drivers come back from the US having acquired the disease in that country. We also know that many people still continue to travel despite the fact that there's a federal government order federal government directive in place recommending and discouraging against non-essential travel outside of Canada. And so I think, but we've seen, and I mean, I just got today an email from Air Canada saying, buy your tickets for a Black Friday sale. And just, it's just one of these things like, now's not the time to travel, folks. And certainly if you're returning, if you're an essential worker, make sure you're taking every precaution that you can because you are exempt from quarantine. And if you aren't an essential worker and not returning for an essential reason, make sure you're quarantining like 14 days, self-isolate, even from the people that are in your home. And if you can't safely self-isolate, tell our federal counterparts so they can set you up with the federal quarantine program.
Would you support the extended Christmas break for schools? I know they said no, and Bonnie Crombie mentioned it 2 weeks ago, and it snowballed into this. Would you support it?
So it's an interesting question. First of all, we know that schools, at least so far in Ontario, have not been shown to be major drivers of community transmission. They more reflect the transmission we're seeing in the community because people get it at home or get it from elsewhere, and then they bring it to school and they get picked up because there's so much precautions. Like schools are like fortresses right now, right? So so in terms of that, the goal is to keep them open as much as possible. We know that kids benefit a lot from being in school, not just from the learning and the education, but also from just social development and interaction. Like it's absolutely vital, especially at that age. And also leaving schools closed for longer, there's lots of questions around equity, right? So you've got a lot of people who may not be able to work from home, and then now they don't have school, so they have to stay home with their kid, like all these other pieces. It makes things difficult for families and parents at this point in time. So I mean, I can go either way on it. It really depends on what our numbers are going to look like, and it's really going to depend on what the situation looks like. But to the extent that we can keep the kids in school and try to stick to the regular break, I think that would be the ideal. Of course, I wouldn't hesitate to recommend an extension if it's needed.
Okay. You brought it up before, the Peel Isolation Center. It's going to be located in Brampton, I believe. What's the latest on that?
So we actually don't know where it's going to be located just yet. We have a current facility that's being used right now, but we're still trying to figure out whether we scale up that facility or locate it closer to some of the harder hit neighborhoods in the region. But the aim is to have it online at least in the next couple of weeks, sometime starting in December. And in the meantime, just really trying to figure out from our data where the best place would be for it to be placed. So at least we have the federal funding commitment, and now we can move forward in actually planning this.
Okay, 2 more questions. Sorry. They didn't tell me how much time I had with you, so, so you tell me. So,
No worries.
Yeah, a restaurant question. This is from a restaurateur. He asks, what's the reasoning for the restaurants to stop serving at 9 instead of 11? It's only 2 hours.
It's a good question. So the rationale, as I understand it, from people that have explored this is we've discovered that after you get past meal times into the drinking time, that a lot more people are actually really bad at physical distancing and masking. And so the idea was to really try to limit some of the behavior that happens when people are inebriated after the fact, just to try to reduce the risk in that sense. And so that's why that time was set. And I think the other thing I'll mention as well, certainly it's I know it's hard for restaurateurs, but we know, if anything, that they want to do their part to also try to protect the community. And I've always advocated, especially for businesses that are impacted by closures and restrictions, that you guys should be getting some sort of financial support or assistance to make it through this thing. So hoping that also pans out as well. Okay.
We recently heard from officials in Toronto that Toronto Public Health had to sign an NDA if they share information to the Ontario government. Is that the same with Peel Public Health?
No, so that refers to the Provincial Public Health Measures Table, which is a table of a number of medical officers of health across the province that are helping to inform provincial decisions. As you know, the province has a bunch of tables. They've got the Public Health Measures one, the Science one, they have the ethics one, they've got a diversity one. Anyway, long story short, there's a whole bunch of provincial tables. The Public Health Measures Table has a bunch of medical officers of health on it. And apparently, as I understand it, the members were required to sign a non-disclosure agreement. I'm not part of that table, so I haven't had to sign anything of that nature.
Okay. And any last message you want to send to our viewers? They're going to be seeing it here. They're going to be seeing it on Facebook, Instagram posts, and everything. So, anything?
So I think the most important message that I have for everyone in the region of Peel right now at this point in time, regardless of what comes down out of the provincial announcement tomorrow, regardless of everything that you understand about what's opened or what's closed, the most important thing that you can do right now to keep yourself, your family, and your community safe is to stay home as much as possible. Limit your close contact just to the people that you already live with. For everything else outside the home, basically try to postpone or try to move virtually just for the next 2 to 4 weeks. And then if you have to go out, make sure it's for an essential reason, such as work, school, getting groceries, medical appointments, exercise and fitness, that kind of stuff. And make sure that you're doing it with precautions of distancing, masking, always, always, always with anyone outside of your immediate household.
Okay. Just letting you know, I've been out twice over the last week, and both times they've asked me if I live in the same household. And one time I was with a friend and they wouldn't see me. So anyways, they're listening.
I'm really grateful for that. And honestly, I'm really grateful for the whole Peel community stepping up. I mean, the vaccines are a great thing. There's a light at the end of the tunnel. We just need to keep going for a little while longer. Cool.
Dr. Lowe, Chief Medical Officer in Peel, thank you so much for joining me. I know you've been quite busy. You pretty much have lived on my TV channel for the last 3 weeks. So, but yeah, thank you so much.
Thanks for having me, Khaled.
All right, take care.
Bye.
They changed this. I don't know how to turn this off anymore.
I think I got it pulled up.
Hold on, there we go.